Thank you, Mr. Speaker. My question is to the Minister of Health. What reports has he received on improved access to medicines?
The Honourable Tony Ryall.
Mr. Speaker, Pharmac has released its annual review for 2009-10. Quite smart, actually.
The Honourable Tony Ryall.
Speaking of medicines, Pharmac has released its annual review for 2009-10, which shows that spending on subsidised medicines has risen from $653 million to $694 million. That is an increase of over $40 million on the previous year. This has allowed 20 new medicines to be funded, and access has been widened for 25 others. This is the largest number of investments in medicine since 1999. And this not only means more people are being treated, but we have prevented many illnesses from getting worse.
Dr. Paul Hutchison.
Supplementary to the Minister of Health. How many people have benefited from more access to existing and new medicines?
The Honourable Tony Ryall.
Mr. Speaker, the total $60 million boost to medicine since the change of government has meant that 250,000 more Kiwis are now receiving subsidised medicines that they could not have got 2 years ago. In total, 3.2 million New Zealanders received subsidised medicines in the 9-10 year, the highest number ever, and this is yet another example that increased spending in health by the National-led government is delivering more frontline services for New Zealand patients.
The Honourable Ruth Dyson.
Does he consider that access to your husband or wife, your family and friends is also important to overall health outcomes? And if so, why did he do nothing to stop the closure of the Taihepe Hospital, causing all the residents to have to move, some up to 2 hours away from their family?
Insofar as it relates to the primary question, I invite the Minister to answer it if he has the information. But the primary question asked about what reports he's received on improved access to medicines. And the supplementary question didn't ask anything about that at all. I'll allow the Honourable... I'll hear the order. I'll hear the Honourable Member under a point of order.
Mr. Speaker, my question asked, did he consider that access to family members was also important to health outcomes, i.e., in addition to the improved access to medicines that the Minister referred to in answering the primary question?
Insofar as that part of the question does have a linkage, I invite the Honourable Tony Ryall to answer it.
Well, Mr. Speaker, what I can say is that the people of Taihepe are receiving a significant number of community services, and it's a very unfortunate situation when the company that was running the services there put itself into liquidation. But we moved swiftly to ensure that we could maintain and improve the other services that could be provided there. The good news for the people of Taihepe is many of them are benefiting from the extra $60 million that this government's put into medicines to improve frontline services for New Zealand patients.
Honourable Ruth Dyson.
What help will access to medicines be to the Campbell family who have moved their 96-year-old father and 93-year-old mother into their own home, are getting no financial support from the government, solely so that their father and mother could stay in their own home and in the district they love?
The Honourable Tony Ryall.
Mr. Speaker, I'm sure if they were in touch with the Whanganui District Health Board, we would be making sure that they got the entitlements that they were allowed to, which I have to say, it would probably be doing more for that family than that member's repeated questions.
Question number 7. The Honourable... I beg your pardon, is it a supplementary question? Honourable Ruth Dyson.
Does he stand by his statement of 19th of March last year that access to cancer treatment must be delivered quickly or District Health Board chairs will be sacked? And if so, has he reviewed the position of Dr. Virginia Hope, given that adults in the Capital and Coast region are now facing waiting times for chemotherapy treatment of over 8 weeks?
The Honourable Tony Ryall.
Dr. Virginia Hope's been there for about a week. It was her appointee, Sir John Anderson, who's been chairman in the previous period.
Question number 7, the Honourable